Hi, and welcome to the Midwest Kidney Network kickoff presentation for 3 of the 2020 projects. My name is Kristen Ward, and I'm here with Candy Coles, our Quality Improvement Director, to give you a high-level overview of these projects. The Midwest Kidney Network covers a 5-state area, including approximately 528 dialysis facilities and 21 transplant centers. In 2019, the Midwest Kidney Network, in collaboration with dialysis providers and facilities, met the CMS goals for bloodstream infection, long-term catheter, and health information exchange, or other highly effective process for obtaining blood culture results. We also met the goal for home dialysis. This year, with your partnership, we hope to reach the following goals. As I stated before, there are 528 dialysis facilities in the Midwest Kidney Network region. Unlike previous years when the network worked with a cohort of facilities in the network region on projects, this year all facilities in the network region will be included in the home, transplant, and long-term catheter projects. The transplant project will include dialysis facilities as well as transplant centers. The objectives of this project are to improve information communication across care settings with an emphasis on communication between transplant centers and dialysis centers, increase the awareness of promising practices to support the patient through the referral to waitlist process, and increase the number of patients on the transplant waitlist using the 5-step methodology. Working with transplant centers and dialysis facilities as well as other stakeholders, we will present and share a variety of strategies, best demonstrated practices, and interventions to mitigate challenges. The 5-step methodology is the foundation outline for referral to transplant, and as the project begins, together we will look at best practices, barriers, and solutions that will improve patient referral to waitlist, offer patient and staff education through a variety of mediums. Improving communication between dialysis facilities and transplant centers will be a key focus. Thank you, Maggie, for your contribution to this presentation by sharing your thoughts. Please take a look at Maggie's comments. The transplant project will run from December 2019 to September 2020. The network will provide progress updates throughout the project timeline to providers. The National Coordinating Center, or NCC, and CMS will have their first presentation on transplant this month on January 21st. Please watch for the invitation and plan to attend. The second project we're going to talk about is increasing the rates of patients choosing a home modality. The objectives of this project are to promote referral to a home dialysis modality, identify and mitigate the barriers to early referral to home dialysis modalities, determine the steps patients and providers can take to improve referral patterns, increase communication between hospitals, in-center dialysis facilities, and home dialysis facilities, and assist dialysis facilities in the implementation of interventions to support patients through the process of training to dialyze at home. Working with nephrologists, primary care physicians, acute dialysis teams, and dialysis facilities, as well as other stakeholders, we will present and share a variety of strategies, best demonstrated practices to streamline communication, and early modality education, as well as interventions to mitigate challenges. The 7-step methodology is the foundation outline for patient education, appropriate referral to home dialysis, and initiation of a home modality. As the project begins, together we will look at best practices, barriers, and solutions that will improve patient and staff education through a variety of mediums. Improving communication between acute dialysis, in-center facilities, and home centers will be a key focus. The home project will run from December 2019 to September of 2020. and the network will provide progress updates throughout the project to providers. Thank you, Patty, for your contribution to this presentation. Please take a moment to read about Patty's experience. The third project is reducing long-term catheter rates. The goal of the project is to decrease the long-term catheter rate by 0.25% in the Midwest Kidney Network region. Even though 0.25% seems like a small goal, this project is being measured on all facilities in the network region, which makes it a very challenging goal to meet. Every hemodialysis facility within the Midwest Kidney Network region is included in this project, and their long-term catheter rates will be reviewed and high performers contacted to review their successful strategies. Some of the strategies that have worked for facilities in 2019 will be incorporated into the 2020 project as well. For example, working with inpatient dialysis providers, nephrologist offices, and vascular access clinics to improve the patient's process towards making an informed choice about vascular access. The long-term catheter project will run from December 2019 to July of 2020. The network will provide progress updates throughout the project to providers. Performance improvement calls will be held in 2020, but the schedule is to be determined. Some units may participate in off-site record review depending on their long-term catheter rate. And here's an example of an educational tool that may be helpful. It's our Fistula or Catheter Patient Perspectives pamphlet. If you would like copies, please contact us at the Midwest Kidney Network and we can provide them to you free of charge. So for all of the projects, what do you need to do? Watch for the monthly calendar from the Midwest Kidney Network and participate in educational activities for the upcoming month. This calendar will be provided through our email list. If you have not signed up for our email list, please go to our website at midwestkidneynetwork.org and click on the envelope at the bottom of the screen. And you can see I have included a little snapshot of what that envelope will look like. If you just click on there and then put in your contact information, you'll be added to our list. You'll also need to attend the NCC and CMS project calls, provide feedback on the value of tools and share best practices, and share successful strategies that your facility or provider group is utilizing. The national NCC call schedule is as follows. The bloodstream infection calls will be on the first Tuesday of every other month starting in January. The home modality calls will be the second Tuesday of every other month starting in January. And the transplant calls will be the third Tuesday of every other month starting in January. All of the calls will be held at 3 p.m. Eastern Time or 2 p.m. Central Time. And a calendar with the dates for these calls will be sent to you in January. The Midwest Kidney Network calendar of events will be included with the NCC calendar for easy reference.
Hi, this is Candy, and I just wanted to let you know one more thing before we close the presentation. Based on feedback from dialysis facilities, the Midwest Kidney Network has established a new resource center. We now have a variety of resources available for you to use for education and training. The resources are provided to you at no cost to the facility. Please contact Allie at the network if you have requests, would like more information, or would like to sign out training models for education in your facility. Here are several examples below of what we're offering to facilities within the Midwest Kidney Network region. We have abdomens for peritoneal dialysis training for you to utilize, and vascular access practice arms for cannulation. If you think your patients could benefit or your staff members could benefit by these tools, please contact Allie and we'll be happy to, again, provide them to you at no cost, as well as mailing and shipping back at no cost. So please give us a call. We'd like to see facilities utilizing these products. And as we increase items in our resource library, we'll let you know what additional things we have to offer. Thanks so much for attending this presentation or viewing this presentation. We'll look forward to working with you in 2020.
Thank you.